Today, we're going to talk about drug-induced movement disorders. It's a different way of looking at things. So both therapeutic drugs and illicit drugs can cause neurological side effects. So anything which blocks dopamine receptors can have an impact on uh, movement disorders. So something like antipsychotics, antiemetics like Reglan can cause. So you want to remember Reglan or metoclopramide. And then there is a severity spectrum, means like some are mild tremors to some are life-threatening conditions. And risk factors are age, drug type, duration of exposure, and dosage. And when you recognize them early, you can treat them fast. And sometimes, like something like a neuromalignant syndrome or a serotonin syndrome may require uh, impact, like use of like hospitalist team or ICU team, a neurologist help. These are things you want to think about. Now let's look at a time-based classification where we will divide into acute, subacute, and somewhat like chronic exposure like tardive. So akathisia is a symptom which usually you can think about in the context of Abilify, and where the person is feeling restless, can't sit still, wants to always walk, um, skin things like something has come out of skin, and a lot of times this akathisia, you could try to give a benzodiazepine, or you can look at Inderal or propranolol also. So think about that. Now, acute dystonic reaction, it means like sometimes like you give a patient Haldol and their neck turns to one side or body turns like that. So something on those lines. So that is because of sudden contraction of muscles. And here also you can either go with cogentin, which is benztropine, or you can go with Ativan. Now, neuromalignant syndrome, which can be acute, is a little bit more life-threatening. Serotonin syndrome is when you're combining either two SSRIs or SSRIs with something which increases the serotonin levels. We'll discuss these things in detail some other time. Um, Parkinsonism is a little bit slow onset and subacute, gradual onset of symptoms. Tremors are also progressive. Now, tardive dyskinesia, which is chronic, is you have exposure of 3 months plus, and even it will be present after drug discontinuation and things like that. So let's discuss a little bit about each one. Again, akathisia is internal restlessness, inability to remain still, and it can be caused by mainly Abilify, I have seen mainly, but other things can also cause. You can stop it. You can give beta blockers and benzodiazepine. Tremors, there are different kinds of tremors, like postural tremor, which happens with like resting, non-resting tremors or combined. So things like lithium can cause tremor in your, clinical journey. You can give propranolol as treatment for that. Bronchodilators can cause, SSRIs can cause. You can reduce the dosage or you can give like propranolol. Now, Parkinsonism is where you have rigidity, postural instability, and bradykinesia, where your movements are slow. Usually it's symmetrical, means it's present on both sides equally, and it resolves with drug discontinuation. Now, tardive dyskinesia syndromes or dystonia stereotype is usually you see it in the tongue or sometimes in the neck. It is complex management and requires long-term strategy. There are new medications like Ingreza, which is being used. So know the generic names of these medications. Now, think about more acute or emergency conditions, which are neuromalignant syndrome, where you're responding because of an antipsychotic side effect. And here, temperature is very high. They have altered mental status, they have rigidity, and they have elevated creatine kinase. The blood pressure and vitals are unstable. Now, for this patient, it needs immediate hospitalization and ICU care. In similar turn, serotonin syndrome is also an emergency. I have seen it sometimes, like when we combine risperidol with SSRIs, or anything which increases serotonin with SSRI, that can cause that. So rapid onset within hours, and there is like clonus in this. So if you hear clonus, then you want to think about serotonin syndrome. Okay. Now, what is the way you want to treat these things? Immediate recognition and assessment is needed. You want to try to reduce the dosage or give some treatment or do both sometimes. Okay. And regular follow-up is needed and prevention of reoccurrence and patient education. I hope that helps.